adolescent pregnancy has been termed as a notable obstacle in the fight against HIV and AIDS infection. Meru County recorded a noteworthy increase in the number of teenage pregnancies, with 26% of girls aged 10 to 19 either pregnant or having already delivered. Our reporter Andrini Kilemi visited Meru County and now brings us the story of the burden of teenage pregnancies. Take a look.
She arrives at Motwati Sub-County Hospital located in Egembe North constituency, Meru County, for antenatal care services. This is Akida, not her real name, aged 19 and already a mother of a 5-month-old baby. Akida is in the company of her cousin, who helps her in taking care of the baby, as she cannot independently take care of him due to her disability.
Tulikuwa tunakaa tukiwa marafiki, ananiambia tufanye kitendo, namwambia hapana. Sasa hiyo kutoka hapo nikiwa namwambia hapana, hiyo siku akaniambia sasa naniaje wewe utakangi kitendo na unakaa rafiki yangu, uonangi wasichana wengine wanafanyanga hivi vitu, na mbona utakangi, unasema utachapwa na wazazi, tutaenda na mzazi hata jua huko nyumbani, tutaenda na turundi, kutoka hapa tukaenda na nikarundi na wazazi hawakujua.
Akida was born with spina bifida, a condition that affects the spine and is usually apparent at birth, a condition attributed to the premature child in the mother's womb.
Nilikuwa najiuliza sasa sina mguu nitatoa wapi ya kulea mtoto, na wakati hata naishi vibaya nasema ni waka katoto nirundi shule. Nasikia tu kuna hata wakati nilichukua blanketi nikafunikia, nikasikia tu roho tena, nikasikia tu vibaya tena, nikachukua nikafunua nikaanza kushikilia tu kakiwa kametoa pumzi.
She is among the many other girls who visit this healthcare facility for antenatal care services, which in a day attends to at least 7 to 10 girls aged 10 to 19 years.
In January, we had 63 mothers, with one being in the age bracket of 10 to 14. In February, we had that two in the age bracket of 10 to 14. In March, we had 29. In April, we had 24. In May, we had 50. In June, we had 66, with 4 in the age bracket of 10 to 14.
The surge in the number of child pregnancies in Egembe North constituency, Meru County, has been linked to the prevalent poverty within the community.
So one of the challenges we have here is that transactional sex is being driven by the cash crop that is grown here, which is the mirror that has liquid money. So in essence, what we are saying is that the system is organized in a way that is easy for a girl or a small child to have sex for pay, and that is part of what the culture that we're talking about.
The deep-rooted culture in Meru community is another major driver of the increase in early pregnancies. The culture known as Geshiaro is a traditional covenant of kinship which is now being abused and used to protect criminals who impregnate young girls.
It's a long cultural, can call it covenanted brotherhood. Long time, our great-grandfathers had this agreement with the different clans because of conflict. So it was brought in to keep peace and peaceful coexistence between the communities, within the community. The consequences of Geshiaro are grave. It is one easy way of, for example, if you have my money, if you take something from me and you refuse to pay me, I will send Geshiaro to you. That person, you will have to give him the money. If you don't, death, pain, suffering of any kind, sickness of any kind.
What is more surprising is that the highest numbers of pregnancies captured within the hospital records are incest committed to uncles, fathers and grandfathers.
And when you look at our data for incest, again we start classifying who are these people who are having incestuous relationship with their children. We again classify them coming from grandfathers, fathers, uncles and brothers in that order.
Sex education and family planning are topics that are rarely discussed here. Parents find it difficult to sit down with their sons and daughters to discuss such issues. This does not only expose the children to early pregnancies, but also puts them at a high risk of contracting HIV, AIDS, and other diseases.
I've realized many girls are really scared. They don't want to mention because of the age. Again, they are fearing. But my prayer is they need to know, they need to understand about the family planning. Many of them are fearing because they are underage. Probably they know they have side effects.
Akida regrets ever engaging in sex at an early age, further calling on the youth to refrain from indulging in worldly pleasures.
Msipende kukaa na boyfriend, mtu akaye peke yake, anda amalize form 4, aende university, akatiwa sasa anaweza pata boyfriend akiwa na job yake, ndio inaweza kuwa mtu akiwa na mtoto na akiwa anategemea wazazi yake inakaanga ngumu sana.
For now, Akida is forced to stay out of school for a while to raise her son before resuming studies later in life. Andrina Ekilemi, TV 47.